Therapies for depression. Many patients who suffer from mood disorders and major depression never seek treatment. With formal treatment, majority of individuals with mania and depression recover within a year, and some might take more time. However, given the enormous amount of personal suffering and lost productivity that individuals endure and the advanced therapeutic interventions that are available today, more and more people who experience these disorders seek treatment. Before we start the video, if you like our video, hit the like button and do not forget to share and subscribe to our channel for more informative videos on mental health awareness and learning. Coming back, different therapies or treatments target different factors. However, successful treatment of any one factor will affect the others. For example, improving disrupted brain functioning will alter a person's thoughts, moods, and behavior and interaction with others. There are several forms of specialized psychotherapy developed since 1970s that have proved effective in the treatment of depression. Cognitive therapy. Cognitive therapy, the seminal cognitive treatment of depression, was developed by Beck in 1977. It typically involves several strategies including education phase, a phase in which the individual learns the relationship between cognition, emotions, and behaviors. Behavioral activation and pleasant event scheduling to increase psychological activity and engagement in social or other rewarding activities. Cognitive rehearsal, in which the individual develops and practices cognitive or behavioral strategies to help them cope with behavioral hypothesis testing or other situations that have previously been problematic. Behavioral hypothesis testing, in which the individual deliberately tests the validity of their negative assumptions in the hope of disproving them. Mindfulness-based cognitive therapy. Another variant of cognitive therapy called mindfulness-based cognitive therapy has been developed in recent years to be used with people with highly recurrent depression. The logic of this treatment is based on the findings that people with recurrent depression are likely to have negative thinking patterns activated when they are simply in a depressed mood. Perhaps, rather than trying to alter the content of their negative thinking as in traditional cognitive therapy, it might be more useful to change how people relate to their thoughts, feelings, and bodily sensations. It involves training in mindfulness meditation techniques aimed at developing patients' awareness of their unwanted thoughts, feelings, and sensations so that they no longer automatically try to avoid them, but rather learn to accept them for what they are, simply thoughts occurring in the moment rather than a reflection of reality. This can also be taken as a group therapy. Behavioral activation treatment, a relatively new and promising treatment for depression, is called behavioral activation treatment. This treatment approach focuses intensively on getting patients to become more active and engaged with their environment and with their interpersonal relationships. These techniques include scheduling daily activities and rating pleasure and mastery while engaging in them, exploring alternative behaviors to reach goals, and role-playing to address specific deficits. Traditional cognitive therapy attends to these same issues but to a lesser extent. Interpersonal therapy. The IPT approach focuses on current relationship issues, trying to help the person understand and change maladaptive interaction patterns. Interpersonal therapy can also be useful in long-term follow-up for individuals with severe recurrent depression. Therapy or treatments have not only shown promising results to alleviate the symptoms, but have also known to improve the overall brain activity, improve physical symptoms, and strengthen social relations. We hope you liked this video. For more videos on mental health awareness and learning, visit us at healthyminds.world and don't forget to subscribe to our channel by clicking on the icon below.